Today we're going to work through an example of inference to the best explanation. For this, we will use the example of Semmelweis and his account of childbed fever. In particular, we will deal with the topic of how to choose among alternative hypotheses, which is also the topic of your reading by Quine and Olien. Today's story is about a Hungarian doctor working in Vienna who did a lot to change medical practice in this century. His name was Semmelweis. In 1847, he was employed as assistant to the professor of the maternity clinic at the Vienna General Hospital in Austria. There, he witnessed many cases of puerperal fever, also known as childbed fever, among the mothers who gave birth in the clinic. Childbed fever was a very serious illness. It affected women within the first 3 days after childbirth and then progressed rapidly. It was accompanied by symptoms such as abdominal pain, fever, and extreme weakness, and eventually even death. Dr. Semmelweis was what you would call a physician scientist. So when he observed the high proportion of childbed fever cases, he set out to collect observations, focusing on two divisions and also on the differences between the hospital and the rest of the city. Here are some of the facts he noted. Okay, so in the maternity ward of the Vienna hospital, there were two divisions, and these two divisions have different mortality rates. So in the first division, the average mortality from childbed fever was around 10%, and there were some peaks reaching as high as 30%. Now, in the other division, the mortality was only of around 3%. Here are some relevant facts. So, while the fever was prevalent in the hospital, there were hardly any cases in the city of Vienna or its surroundings. That is, even of cases of women giving birth on the street or in any other unsanitary conditions, the cases of child fever were less frequent than in the hospital. Furthermore, there were different people working on the divisions. So in the first division, there were medical students who were receiving their obstetrical training, whereas in the second unit, you have midwives. Another fact was that the first division was more spacious than the second. Moreover, diet and general care was roughly the same in both divisions. The last noted difference was this: that the patients in the first division, but not those of the second, could see the priest administer the last rites to other patients, preceded by a bell rung by one of the attendants. So presumably patients in the first division would be more aware of death than the patients in the other division. So here we can see a comparison between the divisions. So we see that in the first division, the mortality from childbed fever was much higher, right? 10 to 30% in comparison with 3%. The second difference had to do with the kind of people who worked there. It was medical students versus midwives. Now the difference has to do with how spacious they were. So the first division was more spacious, whereas the second division was less spacious. And the other difference is that in the first division, there was a priest inside, right, that was going to administer the last rites to the dying patients. Whereas in the second division, the patients were not exposed to the priest. On the other hand, there were some similarities in diet and general care. They were similar in terms of the number of patients and also in terms of training technique. Another important fact to have in mind is that the childbed fever mortality outside of the hospital was basically negligible. It doesn't matter which part of the hospital you were more likely to contract it if you were in the hospital than if you were outside of it. Okay, so you've seen the facts. Now, at the time, there were some explanations that were kind of passed around for this phenomena. For instance, one had to do with epidemic influences, such as, were vaguely described as atmospheric cosmic telluric changes spreading over whole districts. So how does this sound to you? Other explanations for the different distributions of childbirth fever were given in terms of, well, perhaps overcrowding is an important factor. Um, Another explanation had to do with the kind of people working on each of the divisions. For instance, that perhaps it is due to injuries that were caused by medical students, right? And they're given their rough examination techniques. Um, Another story had to do with possible differences in diet. The last hypothesis that we are going to consider has to do with psychological factors, namely with the fact that the priest, the priest that was bearing the last rites for the dying patients, kind of psyched out the patients in the first division, right? Because it just so happens that if the priest had to go to the sick room, right, to administer the dying rites, he had to go through the first division, right, and there was an attendant ringing a bell all the time, right, and this was supposed to have, say, terrified the mothers, right, and make them weak or make them more susceptible to the effects of or to childbed fever. On the other hand, the patients on the second division didn't have this problem because the priest didn't have to go through there, right, to get to the sick room. And I'll tell you what, I'm going to propose my own explanation. So my explanation is that these cases of child fever are due to the presence in the first division, but not in the second, of the vis febrilis hospitalis vienensis maternitatis. Sounds impressive, huh? Well, this label is basically spaghetti Latin for the faculty of producing fever in the maternity of the General Hospital of Vienna. So the hypothesis is that the women who caught the fever were somehow exposed to this vis febrilis, whereas those that didn't weren't so exposed. And last but not least, let's introduce another explanation that I guess is possible in every context. Suppose that this is due to a government conspiracy. And how does it work? I don't know. You fill in the details. I'm sure if even if you don't want to fill it, you know somebody who's going to be able to fill in the details. So we have here a group of competing hypotheses, right? All which try to explain the differences in the number of childbed fever deaths in between the two divisions of the hospital, and then in between the hospital and outside of the hospital. So we have the epidemics explanation, then you have the overcrowding hypothesis, and the hypothesis of the damage caused by medical students, and the diet hypothesis, the priest hypothesis, then you have the vis febrilis hypothesis, then you have the conspiracy hypothesis. Okay, let's try to evaluate each of these hypotheses to see how good they are. So the first one had to do with some sort of like an epidemic that was around Vienna. Now, what do you think? Do you think that, given the information that we have, do you think that this hypothesis is any good? Why don't you stop and think about it? Well, let's look at the relevant statistics, in particular, the comparison between the hospital and the outside. So we can see that the mortality outside the hospital, the childbed mortality outside the hospital was negligible, right? Whereas the mortality rate in the hospital was higher. Now, if it really was an epidemic, right, it wouldn't stop at the hospital, but it would have a greater area, right, being affected. So probably the epidemic telluric hypothesis is probably not going to work. So the epidemic hypothesis is out of circulation. The next hypothesis is the overcrowding hypothesis, namely that that child fever, right, is caused by overcrowding in the ward, right? Now, is this explanation good? Do you think that it fits the data? Okay, now again, pause to think about it. Well, this hypothesis is actually straightforwardly refuted by the data, right? We saw that both divisions have roughly the same number of patients, right? But the first division was actually more spacious than the second. So in the second division was actually more overcrowding, was actually more crowded, right? But the mortality was lower. So this is exactly the opposite to what the overcrowding hypothesis would let us to believe, right? If the hypothesis were true, then the room with the highest crowding would be the one with the highest rate of child fever. But it's exactly the opposite, right? The more crowded is the one that has the fewer cases. So again, this hypothesis is not going to work. So we cross it out. What about hypothesis number 3? That is, the cause is given by the difference in terms of the patient handling, in that the students were supposed perhaps to use techniques that were more harmful to the patients. Well, this hypothesis doesn't seem to be supported by the data either, because in both rooms, right, those like the same training techniques were used, right? Either it is to train the medical students or train the midwives. It looks like, well, it was general, the same techniques, and there wasn't evidence that the medical students were particularly careless or rough in their treatment of patients. Furthermore, the injuries that naturally resulted from the process of birth were observed to be much more extensive than those that might be caused simply by rough examination. And also, we can also see in the Commission's report that when the number of medical students was halved and their examination of the women were reduced to a minimum, that, well, first the mortality declined kind of briefly, but then it rose to levels that were higher than ever before, right? That means that this seems to pretty much refute the hypothesis that childbed fever was caused by rough treatments by means of the medical students. The diet hypothesis is not very promising either. And this is because we were explicitly told that in both divisions, the diet and the general care were roughly equivalent. The next hypothesis on our list is 5, namely that the women on Division 1 were psyched by the priest. Now, Semmelweis decided to test this conjecture, right? And so he persuaded the priest to come through a sneaky route, right, without ringing the bell, so that he could go to the sick chamber silently and without being observed by the patients on the ward. So this eliminated the effect of the creepy priests. But, the mortality in the first division did not decrease after these measures. So the psychological hypothesis had to be eliminated. So the only 2 remaining hypotheses that haven't been refuted by evidence, right, or that are not against the observations, are the vis febrilis and the conspiracy hypothesis. But wait, here there's an info update, so we have more evidence. So first, we have the information that the students, but not the midwives, were also performing autopsies. More information. A physician received a puncture wound in the finger from the scalpel of a student with whom he was performing an autopsy. And that physician displayed the same symptoms that were observed in the victims of childbed fever. Also, the professors and the students used to come to the maternity wards directly from performing dissections in the autopsy room. Once there at the ward, they examined the women in labor after only superficially washing their hands, right? Which even after the superficial washing retained a characteristic smell, yucky smell of somebody who was doing an autopsy. These additional observations led Semmelweis to propose a new hypothesis. So he proposed that what caused the symptoms was some cadaveric matter that entered the bloodstreams, right? And that was because that matter was carried by the students from the autopsy to the maternity wards. So he basically proposed that the cause of the fever was an infection of the blood. So we have three hypotheses at this point. The vis fabrilis hypothesis, the government conspiracy hypothesis, and then the hypothesis about the infection of the blood, or sepsis, right? So just to remind us, these were the facts that had to be accounted for, namely that mortality rates were higher in the first division, and then were smaller in the second division, and then even smaller outside. Second, that remember that in the first division you have medical students who did autopsies, right? Whereas in the second you have midwives who didn't. And so in the first one, the trainees came in contact with infectious material, whereas in the second, the trainees did not come in contact with infectious materials. And also then, in other respects, they were the same, right? The divisions, the same diet, the same care, and the absence of creepy priests. Well, if you think about it, Semmelweis' hypothesis seems to tally very well with these facts. So Semmelweis decided to test his hypothesis empirically, right? And this is how he reasoned. So if the infection hypothesis is true, then the symptoms could be prevented by chemically destroying the infectious materials adhering to the hands. So if the elimination of that infectious material was followed by a diminution in the symptoms, well, that would provide good evidence for Semmelweis' hypothesis. So he therefore issued an order requiring all medical students and professors to wash their hands in a solution of chlorinated lime before making an examination. And apparently the professors were enraged that they were required to do this. And what happened? Well, we'll see in the next video.